Good morning. That's loud. Today I'm going to talk and share with you guys about, I would say, a common problem in the Arab world, which is basically regarding clinical pharmacy and its role in the healthcare system, not only in Yemen, where I come from, but also in the Arab world and maybe also in other parts of the world. So basically, the title for my talk is Clinical Pharmacy, the Missing Piece. So who am I? I am not a clinical pharmacist. So basically maybe Mr. Anas would be the person to be given that speech, but as a pharmacist with a bachelor degree in pharmacy and a PhD in pharmacology, I'm giving this perspective of a pharmacist looking at the healthcare systems and the problems associated with the healthcare system. I basically have a PhD in pharmacology. I teach at Sana'a University as an assistant professor. I also do a lot of teaching pharmacology at different private universities, including the Lebanese International University and several others. So basically, I have no conflicts of interest. I'm not a clinical pharmacist, so I'm not biased to clinical pharmacy. My perspective is, again, as a pharmacologist, as an assistant professor of pharmacology, teaching at several places. So basically, the healthcare system is composed of several components. We have the physicians at one side, and I would say they would be the most important part of the healthcare system. And then again, we have the nurses, the pharmacists, the dentists, and others. And the main concept would be always is doctors are all in all. They are the most important part of the system. And I'm not here to disagree with this, if there are any doctors here. I'm just saying, are there any problems with the current healthcare system? Any gaps, any problems? I think there are a lot. So I think most of us would agree that the offer that we get from from hospitals don't meet the public needs. So not all of us are really satisfied with what the hospital gives us. No discipline in the hospital is really, I would say, the main responsible staff for drug use. So who is responsible for drug use? Is it the doctor? Is it the nurse? Is it the the assistant? Who is it? And we have a lot of unresolved issues in drug use. So who is responsible for modifying the doses? So what if the doctor writes a prescription and there's like a need for increasing the dose or decreasing the dose? Is it all the doctor? Does the nurse have the right to do this? Does she have the expertise in drugs to do this? Who is also responsible for spotting mistakes? Again, doctors are good, and some of them are really like the best, but not all of them are the same quality. And again, as human beings, they do have mistakes. So who is responsible for spotting the mistakes in these prescriptions? And then who is responsible for monitoring the side effects that accompany drug use? Who is responsible for dealing with the complications, whether these complications arise from the disease itself or from the drug use? And who is also responsible for giving further instructions to that patient? Is it all the doctor? Is it the nurse? Is it the assistant? Is it somebody else? And what about the disastrous mistakes that we all hear about in the media and the news from friends, from family, about mistakes that might end somebody's life just because of a medical error that happened in the hospital? So I'll give you just some flavor of the scary numbers that exist. And just to give you an idea of what's going on. So basically, this is a study that was done in the United States, and 100,000 deaths occur annually based on that paper due to errors in patient care. And this is in the United States again, so I'm not talking about the Arab world. 7,000 of them are related to medication and problems with the wrong use of medications. That cost the United States about $77 billion per year. This is another study which basically tells us that on 200 patients who were transplanted, with like kidneys or liver, there were following the transplantation, there were about 800 interventions. So there was something going wrong, and there were about 800 interventions after the transplantation. 28% of these interventions are associated to drug indication. So basically, using the wrong drug for the wrong person. 26% are related to high dosing. So basically, giving extra dose to the patient, which is very dangerous. And 18% is associated with subdosing of the drug. This is another study which shows, or which compares the situation in a hospital which has a clinical pharmacist in the intensive care unit compared to another hospital which doesn't have a clinical pharmacist. And what they noticed is they can reduce the avoidable side effects by about 66% just by adding a clinical pharmacist in the intensive care unit. So a lot of people still think, you know, we don't need clinical pharmacy. Why would we need it? So I'll give you maybe some cases which is maybe closer to the mind. So basically, a leukemia patient received intrathecal vincristine. So basically, vincristine is one of those zinc alkaloids. We call them like zinc alkaloids because they are extracted from vinca. And it's an anti-cancer. It's a very famous anti-cancer drug. But it should be given like either orally or intravenously, but it was given by mistake intrathecally, like in the cerebrospinal fluid. And what happened is basically he died in 2001. So this is a tragedy for one person. Another person received bupivacaine, which is one of the local anesthetics and one of the best local anesthetics that we have in pharmacology, but it was given the wrong way, basically intravenously. It is very potent, so in the same way it inhibits and blocks sodium channels in the sensory neurons, and in that way it could block pain and pain pathway. It can do the same thing in the heart, which can basically stop the heart from beating. So that's what happened. It should have been given intrathecally, but not intravenously, and that led to his death in 3 days. And then you have this girl, she was 3-year-old. She had convulsions post a flu vaccine, and we know that everybody's vaccinated against flu in the United States. But because of the, a side effect, she had some convulsions. Instead of giving her oxygen, what she was given is nitrous oxide. And nitrous oxide is a general anesthetic, and it is very potent, so it killed that girl. What about what we hear all the time about antibiotic misuse? Like, it's a big problem. Like giving the wrong medication to the wrong bacteria, so it develops that resistance against those antibiotics, and now we have a big problem with that. So this is to those who like statistics, it shows the number of deaths in the United States starting from 1999 to 2010, and it shows the increase in deaths that occur as a result of wrong use of drugs. This is another table. It basically compares the death in the US that occur as a result of drug overdose and those as a result of car crashes. And if you compare the numbers, there are more people who die out of drug overdoses than those who die out of car crashes, which basically, should put a big question mark on the healthcare system. So this is on one side. So on one side, we have a big problem in the healthcare system. Now, I'll shift gears a little bit and talk about the other side. What is the role of pharmacists? I think most of you will, and also Anas touched on this, that we have a problem with the role of pharmacists and how people perceive us. So if you ask somebody in the street, how do you see a pharmacist? What is a pharmacist? He might say, well, they count tablets. Big problem. You ask somebody else, he might say, well, they just weigh and measure stuff and, put things together. You ask somebody else, he would say, well, they have shopkeepers. Well, we studied 5 years to be shopkeepers. And then some of them would say, well, they answer the question, tell me how to use this medication. They help us in, reading the prescription. Some people, they would say, they prescribe OTC drugs, which could be a little bit complementary, so we can prescribe some drugs. A lot of people would say, well, they're not healthcare professionals at all. They're just businessmen. They open a pharmacy and start selling, and that's it. Some people would wonder, does anyone need a degree to be a pharmacist? All you have to do is to open up a pharmacy, start selling drugs, and that's it. So I think with that role of, or the dwindling role of pharmacies, and at the same time the need in the healthcare system and the problems in the healthcare system, I would say that both of them created a space for clinical pharmacy. And I would say it's one part of why clinical pharmacy was created. So how is clinical pharmacy different from regular pharmacy? Well, the shift goes now from drugs, from a person who is an expert in drugs in general, to a person who is patient-centered and who tries to exploit his knowledge in pharmacology, in drugs, in toxicology, to the benefit of the patient. So basically, they are experts in therapeutic use of drugs. They provide evaluations, recommendations, not only to the patient, but also to the doctor, to the institutions. They serve in hospitals, clinics, so they're not the regular pharmacy shop people. At the same time, they might also serve in drug information hotlines. So basically in some countries, what you can do is basically call a specific number and ask for a clinical pharmacist. And like if you have a hypertension or if you have diabetes mellitus, you can ask about the drugs that you use, or if there's a problem with the drugs that you use, and they can provide you an answer to that. Again, they provide information to organizations like the World Health Organization, the American Heart Association, about, problems with the drugs, possible side effects, drug-drug interactions with other drugs. So basically, it involves several skills. I would say it's basically a cocktail of pharmacology, toxicology, therapeutics, clinical pharmacokinetics, and pharmacoeconomics, pharmacogenomics. I will just add a little bit of detail about the role of clinical pharmacists, just specific examples. So what about doses in children? Now, a lot of doctors, they deal with children as one entity. So is it a child or is it an adult? If it's a child, give him that dose. If it's an adult, give him that dose. Is that true? Is that correct? So we know that a child goes anyway from 3 kilograms in weight till 20 kilograms in weight, like 6 times difference. And most of us, we deal with kids as one entity. Just, have a spoon 3 times a day, and that's it. And, it shouldn't be the case. So who is responsible for calculating the doses for our kids, basically? And what about renal failure? Again, a lot of doctors, they deal with renal failure as a yes or no question. Does he have renal failure? Yes, give him that dose. If he doesn't, give him that dose. But again, renal failure is a continuum. So it's basically, it could be 10%, 20% failure, 50%, 90%. So who is responsible for calculating the right dose for the right person? And what about pregnancy? Again, we have a lot of, half of the community are women, and they go through pregnancy. And if a woman has a problem with pregnancy, most of the doctors would just prescribe the safest drug. If it's a pain, it's paracetamol. If it is an antibiotic, it's amoxicillin, and that's it. I mean, a lot of them do. But what about the efficacy? So what if the pain is really, really severe? Is paracetamol going to work? So what if this bacteria is resistant to penicillins? What would you do? What other choices do you have? What stronger drugs can be prescribed? I think we have a problem with that also with some doctors. So I guess an expert in drugs would be very, very needed and very beneficial to that patient, to the doctor in prescribing the drug. And what about people with comorbidities? They have hypertension, they have diabetes mellitus, they have something else. What is the proper drug to give in those comorbidities? So basically, it's a rigorous discipline, and we all know that it needs higher criteria for admission. People in clinical pharmacy, they have extensive courses in therapeutics, in drugs, in pharmacology. They have residency programs to be qualified to be an assistant to doctors. So still a lot of people, especially doctors, they just don't like the idea of of the importance of clinical pharmacy, and they say, everything is under control and we take care of patients, don't worry about it. So I'll give you just some pictures. They might stick in your mind just as a conclusion to this talk. So basically, this is a patient, this is a child. It was known, the parents knew that their baby had allergy to penicillins, but again, the doctor prescribed penicillin by mistake, and this is what happened to that child. So what if the clinical pharmacist was available? Wouldn't he maybe helped in this, and maybe he might have intervened and said no, or maybe he would have asked the parents or maybe the child about any allergies to penicillins? This is a peptic ulcer caused by non-steroidal anti-inflammatory drugs, and I mean, if you know the pain that is caused by peptic ulcer, it is very severe. Like it kills you. So basically, this could have been avoided by adding a clinical pharmacist to the crew. This is a child who got anaphylaxis, again, by giving the wrong medication. This is the person who had a photosensitivity because of amiodarone, which is an antiarrhythmic drug. And the other picture on the right, it shows the severe extravasation and the necrosis in the skin that happened because of the leakage of amiodarone from the injection site. So all those problems occur, and these are just some examples. This is a person with goiter because, again, of the wrong medication use. The one on the right is showing bleeding because of an overdosage or overdosing of an anticoagulant drug. So basically, the summary and conclusions from my talk is there are a lot of gaps, a lot of problems that exist, and we need to know the problem first before we go further. Our countries, and Yemen specifically, is lagging behind the other countries in the West, and our countries are losing a lot of money, a lot of lives because of those problems. Clinical pharmacy is not here to push away other jobs. It's not a competition between medicine and clinical pharmacy. They can work together. They can a doctor can just benefit from the assistance that an expert in drugs can give, and it can make a big difference in patients' lives. We need to start from universities. The problem, at least in Yemen, is that we don't have a lot of universities which teach clinical pharmacy. So we have either pharmacy or dentistry or medicine, and that's it. So we need to make it available as a branch of study. Educational sessions like this one, awareness programs are needed because, again, a lot of people, they're not convinced that a pharmacy can work in a by bedside or side by side with a doctor. Perspectives of pharmacists is changing in the entire world, and we need to keep up with that and do the same thing. So basically, pharmacy in the past was a person working in a shop, I would say, but now the future is clinical pharmacy would be more related to the patient, more patient-centered. Now, is that into regular pharmacists? That's what I'm trying to say? No, basically. I'm saying that it's the beginning of a new era, a new period where pharmacists are needed inside the pharmacy. They're needed in pharmaceutical companies, but some of them are also needed inside the hospital, side by side with doctors. So with that, I end my talk, and I'm open to any questions.